University, as well as Tom Cooper, director of the Roundtable for Reducing Poverty in Hamilton, Ontario, in Canada. Once we created the design of the pilot test of the basic income, we need to step into action. We need to guarantee that the intervention are adequately implemented to achieve the expected results. All along the implementation pilot project, will intervene several factors. It is important to bear in mind those factors in order to focus them and to better assess them and to minimize any kind of deviation and problems, issues, and challenges related with design and the initial planning. Those factors could be such as non-appropriate design, communication problems with people and all the organizations participating in the project, changes in the political and economic context, a badly adaptation of human and economic resources, an increasing level of red tape work, a lack of coordination, problems of coordination, internal dynamics, and bad functioning. The implementation, it is a very complicated stage, and it really entails very important challenges. In this sense, our dear guests today will offer their experience when implementing both of the pilot projects of the basic income, the most important that we know. The one in California between 2019-2020 and Hamilton in Ontario in 2017-18. In both cases, they come from Northern American context. They offer very important differences. Sorry, I didn't. Anyway, everything that has to do, I lost my words. Okay, whether if we talk about the experimental design as well as the implementation stages. The Stockton project was funded with private funds, and Hamilton was funded by the regional government. The Stockton project was implemented together with the collaboration of the city hall, and the Stockton was implemented by social organizations and entities. In the Catalan case, the funding will be 100% public, and the implementation will need a narrow collaboration of local entities. Therefore, taking into account such differences as well as different similar aspects, would like to know from our guest perspectives, what would be the differences and the main common points? And to talk about the different issues, such as the conditions, factors, or different situations that made easier or more difficult the implementation. How did you get in touch with the population and the problems that derived from those that didn't want to participate and getting involved in the project? What were the obstacles, the pros and cons that you can see in your specific legal framework? How did you adapt it? How it was adapted, your pilot project in the institutional environment, as well as the existing social policies, how it was compatible with other funds? Did you have to create a specific office for implementing the project? And finally, everything that has to do with the organization. Yeah, at the end of the day, who was responsible to implement the plan? How did you get coordinated with other public and private administrations? And finally, we will have 15 minutes for a question and answer time. Okay, so you have the floor. I don't know. Tom, Stacia, where are you? Who dares to break the ice?
Many questions to answer for sure. I think maybe let's just take them one at a time and give a little bit of an overview of the different projects that we lead, because there are differences among us, and then think about how, some things we would have done different, some lessons learned, the ways that we interacted with institutions, and hopefully that can help inform the Catalonian pilot. So I'll say with Stockton, as mentioned, it was a nonprofit organization that was ultimately formed to implement the pilot, and it was always conceptualized as a research study. So essentially, the way that we recruited individuals was through sending out a mailer. We ran a randomized controlled trial, sent out a mailer to around 4,000 people in Stockton that were at or below median income of the area for the time. So that is to say, we chose a geographic sampling strategy. A person could be way above AMI, way below AMI. We had no income cutoff, so they could still be eligible for the project. So sent out 4,000 mailers, of which only about 500 people responded, of which 478 people were real. So that's a 12.5% response rate of individuals that actually wanted to talk with us. So what happened from there is they filled out a baseline survey prior to randomization into treatment and control conditions. Then what you see happen is folks are chosen for the treatment condition. They onboard at a social services agency, get signed up for what was a prepaid debit card, and ultimately start receiving the guaranteed income. At the same time, you have the research happening simultaneously with the control group, where individuals are receiving surveys every 6 months and ultimately 6 months after the duration of the pilot. I'll kind of say this. I think the one issue that really undergirds all of these in the North American context, all of these pilots, is the issue of trust. That drives take-up, that drives implementation, that drives the way that people treat the money, the way that people interact with the research. Tom, I'll turn it over to you. So maybe you can give us a little bit of an overview, and we can talk a bit about trust.
Yeah, absolutely. Thank you very much, Stacia. So Hamilton's experience with the Basic Income Pilot Project in the province of Ontario in Canada was a little bit different, actually a little bit heartbreaking. Our provincial government decided to test out the idea of basic income. And as many of you may have heard yesterday from Dr. Evelyn Forget, basic income had been tested out in Canada in the province of Manitoba in the 1970s. But this was really the first time from a 21st century context that a government decided to look again at basic income as an important, really income security backstop for the 21st century. So our city of Hamilton, and just as a little bit of background, I am director of a non-governmental organization that really works with people experiencing poverty to try to amplify their voices, as well as to talk about public policy issues that are important to pull people out of poverty. So we weren't involved in the development or design of the basic income pilot, but when Hamilton was announced along with two other cities in Ontario as one of the pilot sites, we thought it would be a good opportunity to really support potential participants and ensure they found out about the pilot, what it meant for them. But we had a number of questions off the top. So the Ontario pilot was really an opportunity to select 4,000 people from across the province, 1,000 people in my community of Hamilton, and individuals needed to be earning under $34,000 a year Canadian, or if you were a couple, under $48,000. And about 50% of the people who were selected, and it was a randomized trial, were already working. Most of the other people who were selected were on provincial social assistance programs. So individuals who had some familiarity with government programs, and that notion of trust, I think, really comes into play. This was, I think Ontario's, we could argue, is probably the most robust basic income experiment that had been tried, both in terms of numbers, but in terms of the level of income that was provided as well. And as the pilot rolled out, we saw many of the same challenges that Stacia already mentioned. The government sent out mailers to low-income postal codes in the area and received a very, very poor response. Most people thought it was junk mail and didn't trust that this was something real. the application form was extremely lengthy and complex, and there wasn't a whole lot of support for people at first. And actually the take-up rate was even lower than what they saw in Stockton. About 2% of people responded, and the government was flabbergasted. They couldn't understand why people wouldn't want to participate in this basic income pilot project when it was potentially a lot more money than they were already earning. But the challenge really was that of trust and building a relationship. And people particularly who were on provincial social assistance programs, already living in the deepest poverty in society, many using food banks, many living in inadequate, unsafe housing, knew the government for years had underfunded these critical social programs, and so just didn't have faith that this was for real. And as some of you will know, it was too good to be true, and I'll get into some of those details a little bit later. But in order to boost the enrollment, what our provincial government did was rely on organizations like ours that did have a relationship and did have trust with people who were already experiencing poverty, to get them to understand the ramifications of what it meant to sign up. We held community forums, town halls. The government committed to having one-on-one meetings with potential applicants. And so that really did help boost the enrollment. And within several months, we did see full enrollment. All 4,000 pilot participants were signed up.
I think this is so interesting, Tom, that at the time that Stockton was launching was the time that Hamilton was ending. And so the people in California were saying, but look at this project in Canada. I can't trust your project, right? If this is what's happening around the world. And I think we often have this completely wrong notion that lower income people aren't paying attention to what's going on globally with social safety net programs. I think now, as guaranteed income, at least in the US, has become more ubiquitous, we face fewer of these trust issues. Most people have heard of a UBI or a guaranteed income in some way. And as you point out, as we move forward, so in the US, there are now over 100 pilots, of which I evaluate around 30. What we do now in community looks so very different, I think, from what we did in 2018 or 2019, and that there is very intentional partnership and public messaging that's happening months beforehand to ensure that institutions that are actually trusted, that are made up of people that look like and speak like the populations that we intend to serve, are serving as a liaison between the nonprofit, between the government institution, whatever it may be. I think one of the things that also has changed the landscape for guaranteed income in the US was the economic stimulus payments, as well as the expansion of the child tax credit, such that there's perhaps not as much stigma associated with receipt of a free cash handout, right? Because that has happened for everyone, earning up to $300,000 in the US per year at this point. So that really changes the way I believe that people think about it. In that context, should we kind of go through like what lessons we learned along the way and what we may have done different? I'll say I would not run a research study during a pandemic. That's my lesson learned. I'm really happy that we were able to provide cash supports for individuals throughout the pandemic, but it sure made research very difficult.
I think our big lesson learned was don't trust government, at least in our context. So as Stacia alluded to, the Ontario Basic Income Pilot was canceled early. And this was despite promises from all of the political parties that it would continue. We had an election in 2018, just about a year after the Basic Income Pilot got started. And the opposition Conservatives were elected, and despite during the election saying they wanted to see the results of the pilot, less than a month into office, they decided that they were going to cancel it. It was a shock to everybody. and absolutely through the lives of 4,000 courageous participants into absolute chaos. People had made plans to be on the basic income pilot for the full 3 years it was intended. Some people were going back to school. Some people were upgrading skills. Individuals had moved into safer, more accessible rental accommodations. And then when the pilot was canceled, they went back to their initial incomes, whether it was working income or provincial social assistance programs, and they could no longer afford to do those things. And so that for us was really, I think, the biggest lesson learned. And although there's been a lot of public debate here in Canada about the early cancellation of the pilot project, one thing that we haven't really talked about, maybe as much as we should here in Canada or maybe internationally as well, are some of the ethical obligations to pilot participants. The use of what human beings in social science experiments really needs to be, I think, addressed. We're currently in the process of reviewing some of those ethical standards in Canada and really trying to explain what we could do better to protect people who suffered incredible harm as a result of the early cancellation of the basic income pilot. So if I do have a caution, it would certainly be ensuring that there are legal and ethical protections in place for any pilot participants, because we never know what's going to happen. You know, governments get elected, governments get defeated, priorities change. But if you have a very vulnerable group of people participating in an income security pilot, there needs to be absolute safeguards in place for those individuals.
Muchas gracias, Tommy. Muchas gracias, Tommy.
Thank you so much, Tom and Stacia. Do you have any questions here in the room?
Hi, thank you both for your participating. I have a question to you, Tom. Did you mention that you just registered 2% of take-up rate?
Yes, that's correct. Initially, it was a very, very low take-up rate. And again, it had to do with the complexity of the information that was sent out by the government to encourage people to apply for the basic income pilot. And again, that level of trust, people just didn't believe it was for real. And so that's why it was important for organizations that people in the community trusted to get behind the idea. And I'll be honest, after the pilot was canceled, I've certainly felt a certain level of guilt for encouraging people to sign up. At the time, it seemed like a good option. People could improve their income for a 3-year period. It might give them opportunities to improve skills, to get into better living conditions, to eat healthier, to stay healthier. And we trusted that the pilot would continue for the full 3 years because we had that, not only the guarantee from the government that was in power at the time, but from the opposition parties as well, that they would continue to run the pilot. So in terms of the take-up and level of interest, I'd certainly recommend community town halls, information sessions. The government eventually established a 1-800 telephone line so people could call up, ask questions about it. And I think the most important aspect in terms of improving enrollment was the government offering one-on-one sessions. So people could make an appointment, come sit down, ask questions about what the basic income pilot might mean for their individual circumstances, and then sign the application form in really a more comfortable way than filling out this lengthy 50-page application. So.
Ok, gràcies, Tom. Volia preguntar respecte a això.
Thank you, Tom. I would like to ask you about that. Do you think that the fact of it just being only 2% in a way biased the sample of people participating? Do you think it was biased?
Do you hear me, Tom?
Sorry, no, I didn't catch the question.
Okay. La pregunta és si
so my question is whether the fact of you having only a 2% take up biased your sample in a way. The fact of having only one type of people participating.
My apologies, I'm not getting a translation.
Do you hear me?
Okay, so my question is whether if you just had a 2% of take-up rate, this low rate did affect or this biased the population, the kind of population who took place in the experiment? Let's say, for instance, the most educated population or the youngest ones, or just males instead of females, whatever.
Yeah, that is a very good question. At the Ontario pilot was specifically targeted to low-income individuals. And so it was a negative income tax model as opposed to a universal basic income tax model. So the government decided to specifically target certain neighborhoods where they knew low-income people were living in terms of trying to get individuals in those areas signed up potentially for the pilot. The in terms of the demographics, I think it probably tended to be people who had a little bit more trust in government, who might be more inclined to sign up. So in that sense, it may not have been completely randomized, although there was I think an attempt by the government to make sure it was randomized for low-income people. Is that helpful?
Yeah, thanks.
I just want to add one additional thing, the way that sort of the zeitgeist of UBI has shifted. So we just launched LA County's, so Los Angeles County's guaranteed income program application yesterday. And by this morning, we have received over 80,000 applications. So in a 24-hour period, there's 80,000 applications for what will ultimately be 1,000 slots to receive the guaranteed income. So my things have shifted from our 12 and 2% response rates.
¿Alguna pregunta más?
Do you have any other questions?
No. Bueno, it's okay.
Since there's no questions, I just wanted to add something to the earlier discussion. You know, when Tom was responding to and you know the sort of discussion of trust and what happens around there. So there's an interesting thing going on in the Finnish experiment, so to speak. So one of the points that people often make is saying that, look, great in Finland, as Heikki Hilamo in the previous session was saying, participation was mandatory, so we don't have those problems, right? So we don't have the issue of people throwing away letters and untrusting and not signing up. Turns out that there might actually still be a problem because people were mandatorily registered. They still got a letter from Kela, you know, the people who are running the show. But now there's some anecdotal evidence that these letters were still thrown out. So what you have then is people who are enrolled in a basic income program without actually realizing what it means to be enrolled in a basic income program, right? So you're actually measuring people's behavior, and the people themselves are not necessarily, possibly not fully responding differently because they're just not aware that they're, you know, that they're sort of being treated differently or that they should be treated differently and so on and so forth. So it raises all sorts of interesting complications, even when you have a compulsory program, right?
I mean, yes, clearly. Oh, in the cases where it's not a mandatory, I mean, enrollment, right? Then you have bias in your sample. You can only speak to those individuals that ultimately signed up for the program. There may be something, you know, categorically different about them. Typically, what we see is a much higher rate of women that sign up for these programs, specifically because of the feminization of poverty. So I think those sort of compulsory enrollments, which I imagine have an opt-out, provide something really interesting in terms of being able to speak to true universality and true generalizability in the way that opt-in programs cannot.
Yeah, if I can, I'd just like to take a couple minutes to talk about some of the participants themselves. Early in the pilot project in Ontario, after the government announced its plans to roll out this 3-year basic income, we started getting quite a few media calls from outlets around the world, really wanting to find out a little bit more about what this experiment meant and you know, what kind of people were going to apply. One of the early calls we got was from the Wall Street Journal in the United States, and as you can imagine, Wall Street Journal is fairly business friendly. And so they came to town probably with a little bit of a critical view of basic income, and they decided to do a mini documentary on this Ontario experiment, and they framed it as giving away free money to people. And although nobody was officially signed up when they came, they did interview people going to information sessions about it. And the narrative that they developed, I thought was a little bit unfortunate because, again, it was making it sound like people were trying to access this free money, and maybe there wasn't value in the program. So we felt very strongly that it was important for basic income participants to be able to tell their own stories in their own way, and really to amplify their voices. And so we started a speakers bureau of basic income participants, and these individuals self-selected themselves, but we gave them an opportunity to get some training in media engagement, in public speaking, so that they could really develop a story and talk to those who asked, make presentations about what it was like to live on basic income. And it was really an opportunity for social inclusion and to ensure that they were able to talk about basic income in the way that made them feel most comfortable. And it was absolutely phenomenal. We had about 10 different basic income participants, all from different walks of life, who developed who were involved in this training and were able to be part of the Speakers Bureau. We called it Living Proof because it was living proof that life for them was certainly much improved on basic income. And again, although the pilot was canceled, while it was up and running, it was, I think, a really great opportunity to be able to share stories, everything from people on the basic income pilot being able to buy a new winter coat, to purchasing more groceries, to finding a better place to live. And they were able to share these stories with media and in public presentations. And I think it went a long way into breaking down some of the negative stereotypes about basic income and really opening people's minds about what it could mean. And so that's certainly something I'd recommend is working with those pilot participants, if they're comfortable doing so, enabling them to amplify their experiences on basic income.
I didn't know we stole that idea from you, Tom. So we did something very similar. And you're right, like there's this sort of negative media coverage that people, I mean, can easily fall into, because you get identified, you feel like you have this opportunity to go public with your experience, and then your experience is maligned. And the best way that you can do that is to, if you want to change the narrative, then you change the narrator.
Absolutely.
Hola, Stacia, una última pregunta. Gracias per la teva presentació.
Hi, Stacia. One last question. Thank you for your presentation. Now that in the US, it seems like the pilot schemes have a sweet moment, and you have this campaign of majors for basic income. Do you have the feeling, or do you fear that some of the issues around implementation that you experienced in Stockton in the past could become bigger and could affect the other pilot schemes that are being designed now?
I am less fearful of the things that we have discussed here today, including trust and take-up. I think that in the US context, we're to the point where, as I said earlier, it's kind of common enough, people understand it. We've completed a number of different pilot programs so far. So those things I worry about less. My major concern for the pilots going forward certainly is related to the interaction with other public benefits. So of course, in the US, we have a completely decentralized approach to public benefits, where, the regulations to receive income support through our traditional welfare system can differ state by state, even jurisdiction by jurisdiction. So a person's receipt of a guaranteed income in Tennessee may result in them absolutely losing all of their food stamps or SNAP benefits, whereas in California may not look that way at all, and there may be no reduction. So that's, I think, for us, given the very retrenched welfare state that we live in, and the stingy and generous one, that my major concern is that we are at a place where we really need a federal or an executive order that would exempt receipt of a guaranteed income from counting against lower income people's existing benefits.
Yeah, just to follow up on this, and in a way, you kind of partly answered what I was going to ask. I mean, one of the things when Tom said is, don't trust government. I mean, I absolutely can see where that comes from. And of course, many people actually, partly in response to the Ontario experience, have said, well, we need to totally bypass government, and we need to go with private funding and private organizations and so on. The biggest problem with that, of course, is that at the end of the day, if you want to really run this at a serious size, you can't bypass government, right? So you need to have some sort of buy-in. I mean, in Finland, that actually required special legislation, and that was pushed through very, very fast. And that was fine. And of course, in Finland, it actually came from the government, so that's straightforward. In Ireland, that's what's happening now as well. But a lot of the experiments are sort of bottom up. And then one of the biggest challenges is precisely, the interaction with government, and what's the fine balance between, having healthy skepticism and distrust, and on the other hand, having to collaborate with them because of the rules and the regulation, but also because at the end of the day, once your pilot is done, you kind of hope to be able to push that into policy development, and you need to engage with them, right?
Yeah. Yeah, if I can jump in on that, I agree completely. I was being somewhat facetious when I said don't trust government. I think you could trust government as long as it's verified, and there are, again, airtight protections for pilot participants. Our pilot participants are actually still engaged in legal action against our provincial government through a class action lawsuit, and we're 4 years now almost since the cancellation of the pilot, and those individuals are still fighting the government to try to receive some remuneration from the harm that was caused. But I absolutely agree that when it comes to resources, when it comes to public policy, you need government as a partner. In Ontario, I think, I hate to say it, but the cancellation of the basic income pilot, if people weren't paying much attention to basic income before the cancellation, they certainly were afterwards, just because there was so much astonishment and because of the cancellation. And people started looking at basic income, I think, closer, and certainly, the basic income in Canada, I think, grew as a result of the government's decision to cancel it. If they had just allowed it to make its way through the pilot and then quietly said we can't afford this, it would have been a different story. But I think just the fact that the way it was canceled, I think, garnered a lot of support for the idea and got people looking at it. So from that perspective, despite the incredible harm that was done to people, I think there were some positives that flowed from that.
So in the US, we've absolutely seen this shift from philanthropic dollars to public investments, which we needed to have happen, as you rightly point out, in order to build a sustainable model that could actually create a pilot to policy sort of trajectory. So what happened most recently, of course, is the CARES Act and ARPA funding in the US, which was built as pandemic support, really catalyzed local governments and some states to say, we want to invest in guaranteed income. And so they had this new influx of cash, right? And they're thinking, how do we give this out in a way that makes sense for the most vulnerable, especially whenever it came to frontline workers. So there was a focus in a number of places, St. Paul, Minnesota, and Los Angeles, New Orleans, of how can we focus these dollars. And so that's the first public investment that happened was only, last 2 years in the US. Now what we see is guaranteed income becoming part of municipal budget appropriations. So Los Angeles, again, here has just appropriated $36 million to their pilot. Similar, I think, around $45 million in LA County. So I think we're slowly gaining momentum, moving that track from the philanthropic sort of spark to an ember here in municipal and state funding.
Bé, moltes gràcies, Tom i Stacy, per la vostra...
Okay, thank you so much, Tom and Stacia, for your contribution. Now we will move on to the closing. We have with us the Secretary on Equality at the Catalan Minister of Feminism and Equality. Thank you very much.
Hola, molt bon migdia a totes i a tots.
Hello, everyone. Today I'm representing the Catalan government, as I often do from my position, but I am also representing the Catalan Ministry of Presidents. Laura Vilagrà couldn't make it. That's why I'm here on her behalf. So I will close this event, and I'm really happy to be here because I think that it's a great pleasure to me to be able to see the work that you have done these 2 last days. First, I would like to thank and to recognize all the organizing team and Sergi Raventós for the organization of this seminar. And of course, I would like to thank all the experts and all the specialists that joined us, and more especially people here in the room, because you represent those that couldn't be here. And thank you, because thanks to your work, things have reached the current point. So we are at the starting point of this pilot scheme, because when we talk about basic income for Catalonia, we are talking about dignity and we are talking about justice. And as a Secretary of Equality at the Catalan Ministry of Equality and Feminism, I feel really comfortable with that because the basic income is talking about justice, about ethics, values, and also feminism. Because when we talk about the fight against poverty, we are talking about a type of poverty that is mainly impacting women and children. So I would like to remind you that this Catalan Ministry of Presidents covers many dimensions. Our objective is to put people at the center, at the core of our governance. This government focuses on the great and main issues in our society. We have, for example, the mental health program, the housing program. We push forward several activities. We coordinate several activities so that we can have a very nice music from one single orchestra. So we are in charge of this, of the design of this public policy. And our mandate is to design this pilot scheme. We are dealing with a very important subject, and you are more experts than me, and we cannot fail. We will need to really succeed in the design of this pilot scheme, and we will need to invest a lot of efforts in the implementation of this basic income. So we cannot just based on the trial and error principle. We need to actually learn from the experiences that have worked and also from those that haven't worked. But these 2 days have been very important because you have defined, you have discussed the path to follow and the paths that we should not follow because other experiences tell us that those paths were not sufficiently validated by the citizenship. So 3 main principles in this project, the unconditional, universal, and individual rights. And we need to focus on the universality aspect. Our purpose is not to focus on a specific group of people, but our starting point is this universality. So with that, we are recognizing people's rights. That's what we do. We really acknowledge the human rights. We need a validated project, an ambitious project, project that works well. Thank you for your work. And we will have a pilot scheme which will have 5,000 participants. This is important. And it will be designed in 2022 and it will be implemented in 2023, 2024. So little by little, we will get started, and we have this predetermined calendar. Our goal is to find the best pilot scheme possible based on this universality approach. When a government, when a society implements such an important tool, not only they are implementing a policy for some specific people, but they are also generating a public discourse. That's what we want to say. We don't want to leave no one behind. We want that the welfare level that we have reached is not only for some parts of the population, but we want it to be available to all. So our legacy as a country, saying that we have a good welfare state, this means that everybody needs to be at the same level of welfare. We can't have a situation where many people are up and most people are in a bad situation. So we need to implement strategic actions so that this basic income reaches the participants, but we also need to run strategic and pedagogical activities and communication activities. I think that we need to reflect on this. We need to take a lot of lessons, and we need to feel proud as a country of being able to really help everyone in our society. The goal is to live a better life, not just individually, but also as a society. So I insist on thanking all of you. I also thank the pilot scheme office. Thank you for the work. And I encourage you, on behalf of the government, I encourage you to continue with this work, which has just started. And congratulations. Thank you.
Bé, moltes gràcies.
Okay. Thank you, Mrs. Mireia Mata, for these closing remarks. Thank you. Well, actually, I would like to really reflect on what we said. We have been discussing on the design and implementation of our pilot scheme.
So after these 2 days, I'm have a very positive impact. We do get some lessons. They are not the conclusive ones. We had the participation from people coming from all over the world. I do thank the work that has been made by all the people in our office, the role that the City Council has played. Although I would also like to thank you all for coming. Some of the discussions were a little bit tricky, difficult to understand. We talked about different proposals in Catalonia. We talked about the importance of the assessment and the evaluation. Many people participated in coming from all over the world. I would also like to thank to the participants that wake up so early. We had to change the schedule for those speakers coming from North America to be here with us. They had to wake up very, very early. That's why I feel deeply thankful. And also I'm thankful to those that organized this event. Let me just tell you that the Catalan pilot scheme, it is something that is getting ready. We will face loads of obstacles and as well as many challenges. I think that the collaboration amongst all the departments and bodies, it's vital to continue working. We hope that we will be able to speak together with all the stakeholders, trade unions, political parties of any kind and color. We hope that they will offer their support to this pilot scheme. As for the communication, we took well note about all the lessons of this pilot scheme taught us, as Miss Mireia Mata told. We know the way forward right now and how to reflect on the issues that will come in the next future. We are facing loads of challenges, that's right. But on the other hand, we trust. We trust in ourselves. We are focusing towards a goal. The goal it is to reach this universal individual basic income. It is a non-stoppable debate. We think that all over the world we are talking about it. We were astonished about the amount of pilot schemes that are implemented in the US. So this is a new reality that will stay for good amongst us. The way forward, a new scenario in which we will have all the material conditions satisfied in a society that is more and more precarious, where the job market is more and more volatile, where people get a job and suddenly are fired. It is very difficult to master this kind of situation with the traditional policies, policies that are not able to face the new challenges that we all share as society. It is not an issue of ending with poverty. I think that if this was the case, we will improve the policies that we have in our hands. But also we need to improve on making people's freedom better. We need to think about how to plan people's lives for them to be free and to have a more fruitful life. I think that the basic income scheme has this double-fold goal: material freedom as well as citizenship freedom. That's all. Thank you very much for your kind participation, and we count on you for all this way forward. Thank you.